Historically, the treatment for breast cancer was a mastectomy. Thoughtful surgeons appreciated that for early lesions that may be excessive treatment, and thus the evolution of a modified radical mastectomy. The next logical step was to simply remove the cancerous lump and the lymph nodes and see how well those patients might fare. They found, however, an unacceptable high rate of recurrence, generally around the area where the lump was removed. For several decades now, after a lumpectomy, 6 weeks of radiation is performed to eradicate microscopic disease that may be left behind. The result then is a cure rate equivalent to a modified radical mastectomy. The latest direction in treatment of early breast cancer is partial breast irradiation. I recently attended the second annual American Brachytherapy Society Breast Brachytherapy Conference. Some of the newer strategies are also much faster. They involve either a multi-catheter needle implant to the area around the lump or placement of an inflatable balloon into the lump. Then we introduce a radiation source through the shaft of the balloon into the core of the balloon. That emits radiation internally out to the periphery of the balloon, the area around the lumpectomy, which is the area at highest risk for residual disease. These treatments take about 15 minutes, twice a day, and can be done in 5 days. For many people, particularly in southern Utah, where they live 50, 100, 150 miles away, there's an obvious advantage in completing their treatment in 5 days rather than 6 weeks. This is a newer strategy. Early clinical results are very favorable. Again, as with all treatments, it's not a blanket approach for everyone, but for many individuals, it's an excellent approach and allows both a quicker treatment and, by treating only part of the breast, sparing the balance of the tissue, preventing radiation side effects such as redness and firming or fibrosis of the tissue.